Welcome, everyone. My name is Mina Nabavi, and I'm a program director with the University of Alabama at Birmingham School of Public Health's Office of Public Health Practice. I'm excited to welcome you to today's webinar, Rising Infectious Diseases, Understanding the Post-COVID Surge, featuring Dr. Molly Fleece, Associate Professor in the UAB Division of Infectious Diseases and Associate Healthcare Epidemiologist for the UAB Health System. This webinar is made possible by the Alabama Regional Center for Infection Prevention and Control Training and Technical Assistance, or ARC-IPC. The ARC-IPC was established to meet the consultation and support service needs surrounding infection prevention and control throughout the state of Alabama. The center is a collaborative effort of the Alabama Department of Public Health's Infectious Disease and Outbreaks Division and the University of Alabama at Birmingham. The ARC-IPC provides training and technical assistance to infection prevention and control and public health professionals in areas needed to detect, respond to, control, and prevent infectious disease outbreaks. You can learn more about the center, view and listen to past trainings, webinars, and podcasts, request training and technical assistance, sign up for our newsletter, and view infection prevention and control resources at the website listed on the slide. You can also email us at arcipc@uab.edu with any questions. We would like to thank our co-sponsors for today's webinar, the Deep South Center for Occupational Health and Safety, the Alabama Statewide Area Health Education Centers, and the Alabama Public Health Training Network at the Alabama Department of Public Health, part of the Region 4 Public Health Training Center. You can learn more about their programs and these centers as a whole at the websites listed on this screen. We'd also like to let you know about our next upcoming webinar, Think TB, Raising Tuberculosis Awareness and Enhancing Public Health Practices. Join our upcoming webinar to enhance your knowledge of tuberculosis and its implications for public health practice. This session is designed to help public health professionals recognize transmission risk, understand local and national epidemiological trends, and explore the significance of treatment burden and compliance. This webinar is presented by the Region 4 Public Health Training Center and is co-sponsored by the Alabama Regional Center for Infection Prevention and Control and the Southeastern National Tuberculosis Center. It will be held on April 2nd at 11 a.m. Central Time, and you can register by scanning the QR code on the screen. Continuing education credits have been approved for nurses by the Deep South Center for Occupational Health and Safety for this program. In order to receive credit for this training, you must register for the training, watch the entire program, and complete the evaluation following the program. Upon completion of the evaluation, you will be redirected to the Alabama Nursing CEU request form, which you will also need to complete. CEUs will be awarded by the Deep South Center for Occupational Health and Safety. CE units for this program will expire February 25th, 2026. If you experience any issues, please email arcipc@uab.edu. We'll place this email in the chat box as well. And finally, it's my pleasure to introduce our speaker. Dr. Molly Fleece is an associate professor in the UAB Division of Infectious Diseases and an associate healthcare epidemiologist for the UAB Health System. Dr. Fleece completed her medical degree at the University of South Alabama College of Medicine. She then completed her internal medicine residency and infectious diseases fellowship training at the University of Virginia. She is a clinician educator with interest in general infectious diseases, antimicrobial resistance, hospital-acquired infections, and infection prevention. Now, Dr. Fleece has presented for the ARC-IPC before, so welcome back, Dr. Fleece. We're so happy to have you, and I'm going to now pass things over to you.
Well, thank you again for inviting me to talk on this topic about rising infectious diseases and understanding sort of the landscape and where we find ourselves in this post-COVID world. So this is the setup for this talk, and I'm going to go through a lot of history, a lot of pre-COVID information, how we all felt and what happened during the COVID-19 pandemic, and then where we are today and what we're seeing on the national and international landscape with regard to infection. So to start with a quote from Theodore Roosevelt, "The more you know about the past, the better prepared you are for the future." And so infectious diseases, we know, are a part of the human condition. It's truly woven into the fabric of our history. And throughout time, our customs, economies, even nursery rhymes talking about my 2 and 4 year old have been profoundly influenced by these diseases. And the nursery rhyme being Ring Around the Rosie, talking about different circular rashes of the plague. So there are many different ways to look at changes in history as it relates to infectious diseases. And one of them is shown here on this slide, looking at different epidemic periods associated with different eras of human transportation. So how people are moving. And this is divided out between land, sea, and air. So overland trade networks and war campaigns truly were thought to have contributed to several different epidemics in the Mediterranean era during classical antiquity, and that's in the green. Travel over oceans, so maritime transportation in red and gray, really led to European contact with the Americas, and then subsequent importation of something very important in our infectious disease world, Plasmodium falciparum, malaria, as well as other novel viral pathogens. Sort of fast forwarding ahead to modern times with the introduction of air travel, this is shown in purple, resulted in the importation of the OG SARS, so severe acute respiratory syndrome, to 27 different countries before transmission was truly halted. So through all of these advances of how we move and access the world has truly become more interconnected than ever before in history. And we're seeing this with increases in air travel, trade, and urbanization, both within regions, but also globally. So on the left, you see graphs showing air travel passengers. On the top, you see exports of goods and services, and then urban population. And it's not difficult to see that these curves rise exponentially. And on the right, you're seeing increases in air travel between 1933 and 2020. And so there is truly no place on this earth that is not accessed by people and or the trade of goods. We also know that humans are social beings. So when we think about the movement of people, it's equally important to highlight the social and cultural forces that shape almost every aspect of infectious disease transmission throughout human populations, and how that impacts our ability to measure, understand, and respond to different epidemics. So social structures and communities affect patterns of interaction at all geographic scales, thinking about nuclear families, extended families, visiting families, social activities, social gatherings, and how people get from each of those to the next. These interactions among humans are complex, and all of this has direct impact on what feeds into our data streams and how we can obtain and report surveillance data as it relates to infectious disease and infectious disease transmission. I would be remiss about talking about global change and not highlight the environmental changes that we have seen, looking particularly at population changes and climate changes. So on the left, you see a map of the world, and it's looking at population changes from 2010 and then projections out to the year 2100. And you can see fairly easily that the colors get brighter and warmer, and that corresponds to a greater increase in population. Similarly, on the right, we're looking at average monthly maximum temperatures from 1970 to 2000 on the top, and then projections through 2100 on the bottom. And we are facing a warmer climate by degrees of centigrade as we look into the future. As places become more populated and as these temperatures are rising throughout the world, there's this complex interaction between urbanization and infectious diseases. And I think it becomes more apparent as these changes unfold. Um, some of these changes are certainly for the positive, like improved access to healthcare and communication, but there are certainly negative changes too. So highlighting on the left, novel human-wildlife interactions. When you have urban expansion and land use changes, humans and wildlife that normally were not interacting closely do. And so highlighting our favorite bat in infectious diseases. So looking at different areas, whether it's in Australia, with deforestation and bats coming more into the community, or thinking about things like Ebola in Africa, and how these viruses and illnesses that are in animals are becoming closer to humans, and how it makes that leap from an animal to the human. Other things looking at specific examples of mosquito adaptation to changing environments. So whereas the Aedes aegypti and Aedes albopictus adapt to urban settings to breed in standing water, we have seen that the Anopheles species is less so adapted and has potentially led to some declines in malaria in certain places. All of this, I think, sets the framework for how we think through the emergence and spread of global diseases, and it's under this umbrella term of One Health, which is an integrated approach that recognizes the health of humans, animal, plants, and ecosystems, and the anthropogenic drivers, or what influence humans have on nature, and how we impact these interconnecting global threats. So that of climate change, biodiversity loss or change, and then infectious disease outbreaks. So really thinking through all of these different infectious diseases over time and different outbreaks that we identify in the future, you must consider where people interact with the environment and how animals play a role as well. So all of these factors truly contribute to and influence the emergence of pandemic diseases. So this is a chart from a paper written by Dr. Anthony Fauci in 2020 entitled Emerging Pandemic Diseases, How We Got to COVID-19. And here it's illustrating newly emerging infectious diseases in red, which they define as diseases recognized in humans for the first time. So some key ones on this chart: HIV and AIDS in 1981, Nipah virus in 1999, SARS, the OG SARS in 2002, MERS, and then COVID in 2019. In blue, it's showing re-emerging infectious diseases. So diseases that have historically infected humans, but continue to reappear, whether in new locations, thinking about West Nile, or in resistant forms like the emergence of methicillin-resistant Staph aureus. And then there's one in black, which is a deliberately emerging infectious disease, a disease associated with intent to harm like bioterrorism, and here it's showing anthrax. So in the same paper, there is this chart looking at diseases eradicated or theoretically eradicatable. And it's just incredible to think that we live in an era where we can turn our eyes truly towards disease eradication. So on the top, this is looking at diseases that have been eradicated or are on target for eradication. And on the bottom, these are human infectious diseases that are currently considered non-eradicatable right now. In the columns, it's looking at different disease features that either favor eradication of the disease in blue, are uncertain in terms of relevance in yellow, or are expected to make eradication more difficult or impossible in red. Some of these features, like detection of disease and immunity or seasonality, are subjective and or situationally variable. Others are not. So looking at sterile immunity for life, meaning the ability of a natural infection or a vaccine to induce a type of or a degree of immunity that prevents infection or reinfection and helps to eliminate carriage, as well as transmissibility to others, to animals, as well as the environment. So I think it's important to recognize our successes in medicine and public health. And there are some very significant global successes in the prevention, treatment, and eradication of infectious diseases. Cannot speak enough to the importance of water, sanitation, hygiene, and health initiatives, and how the access to clean drinking water has improved infectious diseases globally, as well as this image from the Wellcome Foundation looking at life-saving interventions made since 1920, of which there are a lot. This is an interactive map. So if you go to it online, you can hover over each of these and it will go into more details about what each of these life-saving interventions were since 1920. But you can see the four main categories are vaccines, antibiotics, other medications, as well as technology. So one of our most significant public health successes has been the eradication of global smallpox. Smallpox being a variola virus that spread easily from person to person. And whereas most people with smallpox recovered, 3 in 10 died, so a 30% fatality rate. Those who did survive often would have permanent scars over a significant portion of their body, especially their faces. Many were left blind. So, thanks to the success of global vaccination strategies, smallpox was eradicated in 1980. The last natural occurring smallpox in the US was in 1949, and the WHO declared it eradicated in 1980. So, a tremendous success for public health around the world. We can also look at our successes as it relates to the improvement in child mortality, as well as these forgotten diseases. So looking at on the left, you see a chart looking at the long run history of child mortality. And not all that long ago, almost less than 100 years ago, the average child mortality was 50% before puberty. And you can see during the last half of the 20th century, this mortality rate truly plummeted. And I think this curve is just astounding to see where we are currently. So in 2020, the global mortality rate was 4.3, but in some countries listed there below, child mortality was at 0.3%, which is just incredible. With this, vaccines and the reduction of cases of vaccine preventable infections, we have seen that many of these vaccine preventable infections have become forgotten or invisible. So people rarely see these diseases that these vaccines have prevented. And as a result, sometimes we fail to appreciate their value. So this data that was published in Science, I think really is a great visualization that sums up vaccines' dramatic positive impact on the number of reported cases of these vaccine preventable infections. And so while many of us may not have any direct memory of some of these forgotten infections, we don't have to look far for how to remember. So turning towards family, our parents, our grandparents, our great-grandparents, and the stories that they share. Turning towards history, towards literature, different places in music, as well as the arts, all have stark reminders for us about how far we have come. So Roald Dahl was one of my favorite authors when I was younger, and this is an image from one of his books. And this is a snippet from something he wrote in 1986, where he detailed an account of his daughter Olivia's death in a notebook. She died in 1962 before the measles vaccine was available. And here he's describing how she was doing normal childhood things, playing with colored pipe cleaners, making crafts. She felt sleepy, and then within 12 hours, she died. So again, we don't have to look far, and there are these reminders from the past about how far we truly have come. So that's looking fairly far back. Fast forwarding to 2019, the beginning of 2020, you see this snippet from the WHO looking at a description of a pneumonia of unknown cause in China. All of this I know is very familiar to everyone on this call, and really introduces the year that the Earth stood still, so 2020, and really focusing on the day that the world stopped, at least here in the United States, March 13th, 2020, when COVID-19 was declared a national emergency. So I think we think of a lot in our lives now as pre-COVID and post-COVID. And this is one example of how we got to this point, everything that led up from the pre-pandemic era to the official declaration of a global pandemic, and then it will segue into the future. And with COVID-19, our world changed, and we changed, everything changed. As COVID-19 had a staggering impact on every facet of our lives across the globe. And there are so many different things that I could talk about regarding COVID and how our lives changed. I don't need to go into much detail about a lot of it because we all lived through it. But to highlight a few things that I think truly do play a role in our post-COVID world and the post-COVID rise in infectious diseases, um, one is talking about this concept of the infodemic. So a pandemic during the time of really globalized digitalization, expanding social media, um, very available internet use, coining the phrase of an infodemic, or the overflow of information of varying quality that surges during an acute public health event. So in this case, the COVID-19 pandemic. And I'm sure all of us felt it, where it didn't matter what we turned on, the TV, our computer, our phone, um, any kind of alert. We were truly overloaded with information. And on one hand, it was incredible from a public health perspective, because there was an exponential production and amplification of very important information, protocols, what was going on in the world, how we could share best practices as well as share data. But it did allow for the infiltration of misinformation, disinformation, and malinformation. And that proved to be quite harmful. It made the infodemic impacted the pandemic in a way that it made it hard for people, whether people in the community or healthcare workers or those making public policy decisions, to potentially identify trustworthy sources, have reliable guidance when they needed it. And there became a lot of different sources. So different scientific organizations, websites, blogs, social media influencers, different apps. So the quality of the information varied quite a bit. And with the information overload, I know it led to many, many people feeling anxious, depressed, overwhelmed, emotionally drained, shut out. So while there was significant good about the sharing of information, unfortunately, we did see some of the bad and the ugly. And this modern and really complex phenomenon of how pandemics and public health crises played out in the media and in the information world is not going to go away. And I think it will continue to accompany all future acute health events. And we all felt that the times they are changing, right? So the impact of the infodemic on COVID-19 was felt in numerous different ways. And one of them was through the practices and attitudes and feelings surrounding the COVID-19 vaccinations. So it's irrefutable that the COVID vaccine saved lives. The graph on the top right looks at a model estimating the number of deaths if we had not had COVID vaccines when we did. And you can look at those as daily deaths on the y-axis, and that's just incredible. And this was after almost less than a year, so 311 days after vaccines were rolled out, that the interim analysis said that vaccines were safe and 94 to 95% effective, which is just truly unprecedented in the history of vaccines. But this all set up the great paradox of our pandemic, being that one of the most successful innovations in public health history, which was the rapid development of the COVID vaccines and rollout of those COVID vaccines, actually had the effect of reducing public confidence in vaccination. And so you can see the chart on the bottom looking at COVID vaccination coverage, those in the US being fully vaccinated. And as we go into 2024, 2025, you can see that number is hovering right at about 20%. And unfortunately, research suggests that confidence in all types of vaccinations has really taken a significant hit post-COVID, so in this post-pandemic era. And we're seeing that in a couple different places, but one looking at coverage of selected vaccines and exemption rates among children in kindergarten. So this is looking at the United States in 2023-2024 school year. This was published in the MMWR in October of 2024. And the overarching message is that vaccine coverage declined to less than 93% for all reported vaccines during this time. On the right, you can see the breakdown between the MMR, DTaP, polio, and varicella vaccines. You can see that this varies between states as well. But overall, we're looking at significant declines in vaccine coverage for our young children. And this is part due to rise of vaccine exemptions in schooling. You can see on the top the number or the percentage of kindergartners exempt from one or more vaccines in the United States. You can see that these vaccine exemptions were non-medical as opposed to medical. And you can see the exemption rate increased to a little over 3% in many different jurisdictions around the country. The national rate is shown on the bottom left, and then you can see just the great state variability with some states like Idaho reaching an exemption rate of upwards of 14%. So I think this highlights that we are going to see more pockets of under-vaccinated or unvaccinated children. And it only takes an ember for a disease to spread in these populations. And again, going back to a quote, because they don't see it and because of how well vaccines have worked, they have forgotten what humanity has gone through. So there are a lot of different factors that have contributed to the rise and spread of new and re-emerging infectious diseases in the post-COVID-19 world. So thinking about which infectious diseases have come into focus today, or when this talk was proposed, what I was planning to talk about. When I initially said that I would be able to give this talk, it was last summer or early fall. And so if you know, there have been a lot of changes in the world since then. And so you don't have to look far on the news to see some inklings of what's going on around the country as well as around the world. And just to pull in a few snippets of headlines from the last week, there is no paucity of infectious diseases that I could talk about today. I think we all feel this. If you have school-aged children, aging parents, are interested in public health or the news, infectious diseases certainly are not gone. So I wanted to pull a few of these out to really highlight today and talk through, and taking into consideration everything that I mentioned up until this point, all of those different factors throughout history about human behavior, human travel, the environment, as well as that One Health umbrella terminology, and taking into account more recent events with the COVID-19 pandemic and how we are here today. So measles. Measles is something that keeps me up at night just in general as a healthcare epidemiologist here at UAB. I dread a phone call for if we have a measles case come in the door, and just how much infrastructure we need to manage these types of outbreaks. This is looking at outbreaks throughout the United States from 2001 to 2024 of measles, and then comparing that to the MMR vaccine coverage in those populations. So through 2024, there have been 10 different measles outbreaks with over 50 cases since measles was declared eliminated in 2000. So eliminated meaning that there is no active transmission in the communities. And 6 of those outbreaks had occurred within the past 5 years. You can see where these primarily were located. And you can see in red, so that is the MMR vaccine coverage, and compare that to the percent of the population that truly needs to be vaccinated with their MMR to prevent a measles outbreak of 95%. You can see in all of these instances, that percentage is significantly less. So looking at the past week, These are our current outbreaks. And I think all of our eyes in the public health world are on what's going on in West Texas. So we have seen significant rises in cases, with an increase of 32 cases in the last 3 days, which is truly an unprecedented growth for recent measles outbreaks in the United States. Most recent numbers have probably around 20 hospitalized at this point, all in unvaccinated or school-aged children. And these cases started in a very tightly knit, unvaccinated community and has spread now to 5 neighboring counties. Most of the families in this community are homeschooled and do not readily seek health care for preventative care. And subsequently, vaccination rates in these communities are low. And when I say low, I mean 1 in 5 children in this area are not vaccinated with MMR. So the vaccination rate is 80%. That's well below the 93% that you need for immunity. What is causing such significant concern right now is if we look next door to New Mexico, there have been 9 cases in a neighboring county. So far, there has not been any identified link between the outbreak in Texas and the outbreak in New Mexico, meaning no true epi-link to suggest spread. However, we do worry about community transition within this geographic range, and then where will it go from there? These outbreaks can continue for a long time in these under or unvaccinated communities without the assistance of a very strong public health infrastructure. And so we're also watching how the different local, state, and national health departments and CDC are helping in these areas. So measles is concerning for a lot of different reasons, but one of them has to do with how contagious measles is and how fast measles outbreaks can spread in these unvaccinated or undervaccinated populations. Measles is unique in that it can stay suspended in the air and remain contagious for up to 2 hours after somebody who is infected with measles leaves the room. So that means someone could get measles by walking into a space where a person with measles was several hours before. We learned a lot about different epi terminology during the COVID pandemic, one being the R naught, or how easily it is for an infection to spread person to person. And with measles, we know that each infected measles patient can subsequently spread to 12 to 18 other people. So the MMR vaccine has been so successful that measles, which was a universal child illness from before 1950, and has since been declared eliminated from the Americas in 2000, meaning that measles was no longer widely circulating in the US. We are hearing a lot of myths about measles and inaccurate information that's being propagated. So one thing I hear frequently is that measles is just a rash. And I think that we don't have to look far or talk to many of our family who either had measles or had was around during the time that measles was spreading in our communities to know that it's truly not just a rash, right? So 10 years before vaccines were available for measles, measles was responsible for about 500 deaths per year in the United States. 1 in 5 unvaccinated were hospitalized, and of those, 1 to 3 out of every 1,000 children infected died. And they died from either pneumonia, which was a very common cause of death, or neurologic complications, that being encephalitis. If the encephalitis did not kill the child, many were left deaf, blind, with seizures, underlying intellectual disabilities, and then the long-term complications of something called subacute sclerosing panencephalitis, or SSPE, which was very rare, but a devastating and fatal disease of the central nervous system. And that would develop 7 to 10 years after the person recovered from measles. So all that being said, measles, again, not just a rash. and thinking about this R naught for measles and looking at the data for clusters of unvaccinated communities, there's a big risk for large and disruptive measles outbreaks in these communities. So what does that mean for us? So we are not in a hot zone here in Alabama. What the public health officials are recommending is that if you were born after 1957 and or vaccinated before 1968, you can get another dose of an MMR. You can check your MMR titers with your healthcare provider. And then if you have young children who are not yet vaccinated, so a baby under 12 months, and you plan to travel, look to where you are traveling and potentially reconsider travel to areas if there is an ongoing measles outbreak. For those who may be in an area with an active outbreak, we encourage everyone to pay attention to their local and public health department, to stay up to date on their vaccinations, and even potentially in those areas, if people have children under the age of 12 months, can go ahead and get a vaccine early, certainly with the advice of their pediatrician. Changing gears from measles, we all have felt that it seems that everyone is sick this winter. And a lot of that has to do with influenza. So thinking more about respiratory virus season. This data is from a couple of days ago, and you can see in influenza, the blue line with the blue triangles and how high it is in terms of weekly positive tests, in terms of percentages, how that compares to other circulating respiratory viruses currently. And I know I can probably speak for all of us that we are just hoping that the flu will start to go away. And I think we're starting to see some data that says maybe we are on a very slight downward trend. So what we have seen so far this season is that we have seen almost exclusively flu A, very few cases of flu B. And so potentially we're starting to see a little bit more now than we did before. Thinking about the different subtypes of flu that we're seeing primarily H1N1 and H3N2. And then the middle two graphs are looking at influenza-like illness, which is defined in the public health space as fever, cough, and a sore throat or a sore throat. On the top, you can see where we are. So that line is starting to go down, yay, but we're still way above where we were during the season in light blue, which is 2019 to 2020, still way above the epidemic threshold. And then you can see in the map that most of the country is still dark red to purple. So flu remains everywhere. Looking at our flu hospitalizations and pediatric deaths on the right, our hospitalization rate this year has already surpassed the last, quote, very bad year in 2017 to 2018. The numbers this past week did come down, and so we remain hopeful that we will see continued improvement over time. And then on the bottom, we're looking at pediatric deaths, which we certainly hope to prevent through vaccinations. And to date this year, we have had 86 pediatric deaths. Takeaway from all of this is that it is not too late to get your flu shot. As long as we still have circulating influenza, the flu shot can still be effective. This year's flu shot does seem to be effective. And remember, the flu vaccines can help avoid getting sick, but the most important thing is avoiding hospitalizations and deaths. And remember, flu is notorious for having a very long tail, as you can see on the ILI and the hospitalization graphs. So it is not too late. Thinking about flu, but in a slightly different way, we all have heard about avian flu or bird flu or H5N1. It is all over the news. This is the highly pathogenic avian influenza. It's caused by subtypes of influenza A, and it varies in severity depending on the strain and which species is affected. This highly pathogenic avian influenza strain is deadly to domestic poultry. We are hearing about it wiping out entire flocks within days, and that's compared to the low pathogenicity avian influenza, which tends to cause few or no symptoms. This occurs naturally in the wild birds around the world, but some of these strains have become highly pathogenic in poultry. So this is looking at the outbreak situation in the last 30 days, looking at different commercial flocks of poultry, backyard flocks of poultry, and then how many number of birds on the scale of millions has been detected. On the right, you can see where these outbreaks are occurring. And in the bottom, this is looking at the different cases that have been identified in Alabama, some back in 2023, and then you can see one in Coleman from January of this year, none in the last 30 days. On the left, it's showing different wild and captive wild mammals that can also be susceptible to the avian flu, and different geographic locations of those mammals. Looking at what we are focusing on today are how this has spread from birds and now impacting dairy herds or dairy cattle here in the United States, as well as human cases. So to date, there have been 70 cases, one death, and to date, thankfully, no person-to-person spread, but this does remain a concern and a reason for ongoing surveillance. In the human cases to date, along the right, this was just published in the New England Journal of Medicine, looking at the epi curve for these human cases and their exposure to either cows, poultry, or one that was unclear. So I think we will continue to hear more about this in the coming weeks to months, and hopefully we will continue to look at this as a low public health risk without transmission person to person. If people aren't sick with a respiratory illness or an influenza-like illness, likely what we have heard about is a GI bug going around. If anybody on the call also has preschool-aged children, my children's preschool was closed on Friday because of norovirus. So we have seen very high norovirus activity with the seasonal line in red on the right, well above the gray and blue areas of seasons past. So what we are hearing about and feeling is very real. On the left, you can see where these outbreaks have occurred by state, and this is part of a CDC established norovirus testing and tracking or Norostat network, for which Alabama is also included, and well over 1,600 outbreaks throughout the country just from August until February, and that compares to 729 during that same time last year. A few other outbreaks going on to mention. One is the tuberculosis outbreak in the Kansas City metro area. You can see the number of cases along this epidemiologic curve on the bottom. For these active cases, there have been 67 in 2 counties in this area. Of these, 35 have completed treatment and are considered cured. 30 at least are still under treatment. Many more are still being monitored. There have been 2 deaths reported related to this outbreak, and hopefully we will learn more about this outbreak as we hear more from the Kansas Health Alert Network. This outbreak is larger than normal for Kansas, but the general risk to the general public remains low. Here, thinking more about history and music, I have snipped something from the TB Blues. One of my mentors in medical school would sing this song to us as he entered into teaching us about tuberculosis during our module. And then thinking about the upcoming TB talk, Think TB, there's a new book coming out shortly by John Green, entitled Everything is Tuberculosis. So whereas in talking to a lot of my friends and family, they're still surprised that tuberculosis is a problem. And I think this is just a good reminder that yes, it is still around. To highlight the importance of human travel and globalization and the importance of health departments and why keeping in close communication and keeping our finger on the pulse of what's going on in the rest of the world is important. There are two active viral hemorrhagic fever outbreaks ongoing, one in Uganda, one in Tanzania. Both of these are Ebola or Ebola-like viruses, hemorrhagic fevers. The one in Uganda certainly sparked concern, being that it was identified in the capital city of Kampala, which has almost 2 million people. What's remarkable during this point is within 4 days of announcing the outbreak, there was the initiation of the first Ebola vaccination trial. And so hopefully we will get more information from that soon. So far, there have been 9 cases, excuse me, to date. 8 of those patients have recovered and have been discharged. Over 200 remain in quarantine, and there has been 1 confirmed death. Looking at the Marburg virus disease in Tanzania, there have been 10 cases so far identified as of February 10th, and all 10 have died. And there are many more that have completed their quarantine time period. But I think we stay vigilant about the status of both of these outbreaks. And then last but not least, let's not forget our friendly flying foes, mosquitoes or mites or biting flies, with these 3 different arboviral disease outbreaks that are going on across the globe as well as locally in the Americas. So predicting where infectious diseases will strike next is a tough topic. And I think what we know is that the new infectious disease threat, whatever that may be, will likely come from either an emerging or re-emerging infection. We also know that our world is changing, and with our changing world, it requires science to change to better evaluate future risks from these infectious diseases. And in our increasingly connected world, the risk of infectious diseases truly is shared globally. So our experience with COVID, I think, really highlights the need for a collaborative worldwide framework for infectious disease and public health research, control, and prevention. In a talk recently delivered by Dr. Fauci, he said emerging infectious diseases are a perpetual challenge. The only way to be prepared for the perpetual challenge is by being perpetually prepared. So what are some takeaways from that I have been thinking about as preparing for this talk and as reflecting on pandemics from the past and our recent experience with COVID? One is to truly expect the unexpected, to be prepared, even if we cannot predict specific outbreaks. We can look back to history. We can keep our finger, like I said, on the pulse of what's going on around the world, to try and be as prepared as possible for whatever infectious disease emerges or reemerges next. I think much of what we learned in the scientific and medical field from COVID was how important it is to communicate about science effectively in order to convey facts to the public and some of the nuances that go into science communication. I think we felt very clearly how misinformation is the enemy of pandemic control. Unfortunately, the pandemic did highlight many systemic health and social inequities, and we know that those inequities made controlling the pandemic difficult. I think it highlighted the importance of incorporating human behavior into infectious disease models and how potentially underrepresented that was early in the pandemic. And then as we learned more about human behavior, how we can use that to think about our infection prevention and control models now, but also how to prevent infections and outbreaks in the future. With modern 21st century science, we have a rapidly expanding toolkit, and I think we'll see more tools coming to the forefront with the next pandemic. We need scalable public health infrastructure, and then with that, highlighting the importance of training the next generation of outbreak investigators, infection preventionists, public health, and medical physicians and staff, and just in general, the next generation. So with the return of all of these once forgotten diseases, it's a stark reminder, and hopefully it's a stark reminder to all of us that the battle against infectious diseases is truly far from over. I think focusing on resources for different outbreaks and global health updates and these trusted sources is key. And so hopefully this will help as to direct you to some really great resources for what's going on with all of these different outbreaks that I talked about and future outbreaks that likely will be occurring. And with that, I will stop and I'm happy to answer any questions.
Thank you so much, Dr. Fleece. We have about 8 or so minutes, so I'll try to get to as many questions as I can, but I would encourage you, please continue to send any questions and we'll answer as many as we have time for. The first one that I have, do you anticipate that the CDC will provide the US influenza strain data to the WHO group in order to participate in flu vaccine decisions for fall 2025?
Yeah, I think that's an interesting question, and I don't know what's going to happen. I think what we do know is that when information is shared widely and transparently, when it comes to these infectious diseases that impact everybody around the globe, I think that's really the only way that we can have a unified front towards combating these. And so with the ever-changing landscape, I think we will just have to see how those avenues of communication unfold.
Gotcha. Why do you think we are seeing a rise in TB post the COVID-19 pandemic?
So I think TB, thinking about that as one of the, as a potentially neglected disease, and as we think about how people have been moving and traveling, and how communities interact together. I think all of that plays into how that tuberculosis outbreak has come about. We truly don't know a ton about it right now. I anticipate that we will hear more about the communities involved from the local and state health departments soon. But I think it potentially highlights how some communities access healthcare, how some of these ancient infections can still crop up in closely housed or underserved people. So I think a lot of medical and social factors really play into it, but more to come as we learn more about that particular outbreak from the health departments.
Another question related to TB. Should we attribute COVID-associated immune dysfunction as a factor in the higher rates of these infectious diseases, specifically TB?
It's an interesting question. And I don't know any particular data about that off the top of my head, but I think as we learn more about COVID's impact on our immune system and susceptibility to different types of infections, I think that would be an interesting thing to look at.
Switching gears a little bit to about vaccinations in general, what childhood vaccination rates concern you the most as an infectious disease doctor? Is it MMR? What keeps you up at night?
Um, I think in general, just the global decrease in vaccination for our kids keeps me up at night. Out of the ones listed and just seeing what we are experiencing in certain under vaccinated pockets of children, measles, it's what keeps me up at night. Not so much because I anticipate us to have measles cases around here imminently, but because I know what measles can do and how quickly it can spread in those under unvaccinated communities. So if I had to pick one, it would be measles.
Gotcha. Has the decrease in confidence in vaccination seen after the COVID pandemic occurred in other countries as well, or is it really just kind of a US phenomenon?
Yeah, it's an excellent question. And I had a table when I took it out and I should have left it in. It's seen everywhere. And some countries, their trust in vaccines has declined more so than what the trust in vaccines in the US has declined. And this is not specific to just COVID. We've seen this in other outbreaks in the past, maybe not just around vaccinations, but about the underlying feelings about the emergence of some of these infections and how to manage them, thinking specifically about one of the Ebola outbreaks from years ago and the public mistrust of the medical community. So certainly not unique to us, not unique to vaccinations. Unfortunately, I think the digital age made um, that noise and those messages amplified.
And related as a follow-up, someone wanted to know if you had any, specific strategies or approaches to help increase vaccine uptake for those of us working in public health.
Yeah. I think really focusing on the data. The data is so striking for what happened with these vaccine preventable infections and illnesses in the past once the vaccines were widely marketed, and how few and far between the infections have been. So much so that these have become forgotten infections, right? Um, the number of people, I'll speak to the US specifically, who have been vaccinated with these childhood vaccines is enormous. And we have many, many, many years of data to support their safety and efficacy. So I think that's one piece in our tool belt. I think the other is just having, good, honest conversations with each other, and then pointing people towards valuable resources, whether that be their children's pediatrician, their healthcare provider, or some of these other vetted and reputable science sources. These conversations are hard, and I have them every day in my infectious disease clinic as it relates to things like influenza vaccines, COVID vaccines, and things like that. So I applaud everyone for having these conversations and these discussions, and keep up the good work.
Yes. Well, we're at the top of the hour. Dr. Fleece, thank you so much for this timely presentation, wonderful presentation. We're so glad that you were able to join us today. So thank you again, Dr. Fleece.
Thank you so much.
And thank you to everyone who has attended. We look forward to seeing you at our next webinar, April 2nd on TB. Hope you all have a wonderful rest of the day. Thank you.